Osteoporosis means soft bone. So your bone is not at the density that we would like it to be, or on average with your peers for your age. And it kind of, the only way to really know about osteoporosis currently is something called a bone density scan, or a DEXA scan. And so you have to get this study, and the report comes back as either normal for your age, or osteopenia, which means slightly soft for your age, or osteoporosis, which means very soft for your age. And once you get into the osteoporosis category, you're at some increased risk for fractures in your spine, called osteopenic compression fractures, or hip fractures, or distal radius fractures. And so, of course, my area is the spine, and so we want to prevent osteoporosis so that we can prevent these detrimental fractures for patients. The soft bone by itself isn't really painful until you have a fracture, and then it becomes painful and difficult. As far as preventing osteoporosis, so if, for sure, moving and staying active and doing some type of light impact, whether that be walking or speed walking or elliptical, but something to get your body in motion, I think helps re-strengthen those bones that you need to have. So I think motion still is life in that scenario, to keep your bones as strong as they can be. Now, once you've developed the diagnosis of osteoporosis, or once you've developed soft bone stuff, then there are some medications oftentimes that we can use that kind of increase the density of the bone to help prevent these big fractures or very detrimental fractures, whether it be the hip or the spine or so have you. So the key is to preventing, I think, trying to stay active as you can. And again, doing baby steps or crawling, then walking, doing anything you can to get some impact to your body, kind of to restore the density or maintain the density of your bone, I think is healthy. But once you've developed it, then we sometimes have to use some supplementation or some medication to get the density up to where it needs to be.